me just. So good morning. Thank you so much for having me here today. My name is Nadia McLennan, and I'm an environmental health specialist with Halton Region Public Health. This morning, I'll be providing an overview of a few chapters of the Climate Change and Health in Halton Region report. This report is the Climate Change and Health Vulnerability Assessment. These assessments are produced through an evidence-based process to articulate health impacts of climate change in a given geographic area. In this case, Halton Region. The purpose of this assessment is to collate research and help identify gaps and vulnerabilities in population groups. They are not strategies or plans, but are intended to support local knowledge and action on climate change. The report covers 7 climate-related risks: extreme temperature, ultraviolet radiation, extreme weather, food and waterborne illness, food systems and food security, air quality, and vector-borne diseases. In the interest of time, we will only be covering 3 of these risks in today's presentation: vector-borne diseases, extreme temperature, specifically heat, and extreme weather. The first area we'll discuss today is vector-borne diseases. On your screen right now is the vector-borne disease in Halton Region highlight report, which you would have received as part of the executive summary that was shared with you by Tricia. In addition to the large climate change report, Climate Change and Health in Halton Region report, it's available, which is available on request. These 6 highlight reports were produced. The reports are available, also available on halton.ca. The large report it's not web friendly. It's 200 pages long, so we decided not to post it because we couldn't make it um, accessible. And this one here is just, it's much easier to go through these ones. There's a lot more visuals available for this. So. Each chapter of the report has a similar layout, with baseline exposure identified, future climate change projections for the region described, priority populations discussed, and there's also discussion of programs, policies, and related actions to improve adaptive capacity and increase resiliency. In the interest of time, I won't be going for the vector-borne diseases chapter. There's so much stuff always going on vector-borne diseases, and I know a lot of things are in the news right now related to vector-borne diseases. So I actually won't be going into too much besides covering Lyme disease, which tends to be very popular discussion point. But I won't be covering West Nile virus or other mosquito-borne diseases in today's presentation. They are available in the larger report. Of note, you might have heard in the news that there was recently a reported human case of Eastern equine encephalitis, a mosquito-borne illness reported in a Hamilton resident. It was a few weeks back. Halton Region was also recently advised of an equine case of Eastern equine encephalitis in a horse in Milton that didn't have any history of travel. There's also been news reports of Rocky Mountain spotted fever, a tick-borne disease, which is not from black-legged ticks, but dog ticks that have been reported in dogs with a history of travel to the Long Point area. And there's also been, I believe, a human case in Quebec. I'm also not going to go into that. You could do a whole presentation, a very long presentation on vector-borne diseases, but I'm going to keep the scope on narrow for today. But you can find, if you want more information, you can find this through news articles that are available right now. Climate change is projected to increase the opportunity for the potential transmission of Lyme disease and other tick-borne illnesses. Increased temperatures and longer warm season is expected to increase the number and activity of ticks, as well as expand their range and the range of their hosts. There's already a seasonal peak incidence of Lyme disease during the summer months, coinciding with increased participation in outdoor activities and the feeding cycle of black-legged tick nymphs. Health Canada actually indicated in their Health of Canadians in a Changing Climate report that surveillance data showed robust evidence that Lyme disease emerged in Canada and began spreading northward because of climate change, causing a dramatic increase in human cases from 2009 to 2017. In Halton Region, there has also been an increasing trend in Lyme disease cases. The figure on your screen shows the number of Lyme cases among Halton residents between 2014 and 2023. There is a clear increasing trend in the number of cases over time. In addition to the increase in overall cases, there has been a substantial increase in the number of locally acquired cases in Halton. In 2023, over 40% of Lyme cases reported Halton exposure compared to all other years. Of note, of the total confirmed cases reported in 2023, only about 20% reported seeing a tick attach to themselves at some point prior to their infection. So that's a really important point to note. Lyme disease is not the only tick-borne disease. Sorry, a small child just ran in, they're homesick. Lyme disease is not the only tick-borne disease in Ontario. In response to reports of emerging tick-borne diseases and an increase in black-legged tick populations across Ontario, three other tick-borne diseases, anaplasmosis, babebiosis, and Powassan virus, were added as reportable diseases of public health significance in 2023. These diseases are not currently nationally reportable. There have been no locally acquired human cases of any of these diseases. However, there have been cases reported across Ontario. All three diseases are potentially fatal, with Powassan virus having a case fatality rate of 10%. Since 2018, Halton Region public health staff have been conducting active tick surveillance twice a year. Testing of ticks identified during tick surveillance can identify the proportion or positivity rate of ticks that carry tick-borne pathogens. This allows the risk of human tick-borne infection to be assessed locally. Since 2019, Halton Region has been considered an established risk area for black-legged ticks. An established risk area is a location where black-legged ticks have been identified or are known to occur and where people have the potential to encounter infected ticks. The Lyme disease positivity rate increased from 0% in 2018 to 27% in 2024. The surveillance information is available on halton.ca with the location of tick dragging, total black-legged ticks tested, and the number of positive for Lyme disease, anaplasma, Powassan virus, and Babesia microti noted. In spring 2025, two ticks tested positive for anaplasma. These were the first ticks in the region to test positive for anaplasma. Despite the risk areas being identified, black-legged ticks can be found anywhere as they feed on and can be transported by migratory birds and other wildlife, including deer and rodents. While everyone can be impacted by vector-borne diseases, some populations are more susceptible than others due to their increased exposure and sensitivity. In regards to exposure, individuals who spend a greater amount of time outside for recreation, hunting, or work purposes, particularly those who work in agriculture, road repair, or those employed in the conservation of rural areas, may be differentially exposed to vector-borne diseases. In regards to sensitivity, older adults that are high risk of health complications due to reduced functioning of their immune system, and the fact because of their age, they're more likely to have other chronic conditions. Children 14 and under are also more susceptible to vector-borne diseases as they have developing immune systems and maybe more reliant on caregivers to communicate risk messaging and engage in protective behaviors, such as wearing insect repellent and protective clothing. In regards to adaptive capacity, there is currently limited Canadian evidence of people with limited adaptive capacity to other climate-related issues, for example, those experiencing poverty, are at a greater risk of vector-borne disease transmission in Ontario. And because of this, there's no standalone section describing population-level vulnerabilities according to adaptive capacity like other chapters in this assessment. Now, adaptive actions. Each chapter of this report identifies adaptive actions at the individual level and those being done by public health and other agencies. Individual actions include protective behaviors like tick checks, wearing insect repellent containing DEET or keratin, avoiding areas with known harmful vectors, maintaining the property, so keeping bushes and shrubs clear of overgrowth and debris, removing standing water. Public health actions include identifying priority populations at greatest risk, monitoring the incidence of vector-borne diseases, public education regarding prevention and personal protection through websites, fact sheets, social media, and attendance to special events, working with stakeholders, including municipalities, conservation authorities, and other public access property owners, and physician engagement. Whenever we have, for example, with the equine case of um, Eastern equine encephalitis, we sent out a notice by eFax to our local physicians, just advising of this and just informing them if they have patients with compatible symptoms that they should also test encephalitis in addition to what testing for West Nile virus. We do conduct case investigations, larval monitoring and control, as well as adult mosquito surveillance, which includes mosquito identification and viral testing. We've already had our multiple positive pools, mosquito pools for West Nile virus this year, and we sent out notification via media release advising of this fact a little earlier in the summer, like about a month or so ago. Actions taken by municipalities and other agencies are also identified, including responding to standing water complaints on private property. Okay. I've included some resources related to vector-borne diseases, including the halton.ca webpage for Lyme and other tick-borne diseases, the Public Health Ontario Vector-Borne Disease Tool, and the National Collaborating Center for Environmental Health, reducing tick-related risks through improved design and maintenance in outdoor environments. There's additional resources that are also in the main report and in the highlight reports. The next section we'll discuss today is extreme temperature. The section of this report covers both cold and heat, but in the interest of time, this presentation will focus only on heat. On your screen right now is the extreme temperature highlight report. Obviously, I'm not going to go into too much detail with it as you've seen it, but it's just kind of give you, just show you how it looks. Now, Halton Region maintains records of the number of heat warnings issued by Environment and Climate Change Canada. If heat warning conditions are expected to be met for 3 or more days, Public Health's Medical Officer of Health will issue an extended heat warning, which is communicated through media advisory e-blast to subscribers, which include municipal employees, long-term care homes, retirement homes, schools, daycares, and congregate living settings. On the screen, you can see an example of an extended heat warning that was issued last year. We've had a few actually issued this year. This year, we've had more hot days than we've had since I think since 2020. There's been 22 days where Halton Region has been under a heat warning with 6 heat warning events called for our area this year. And now in our report, we look at future climate projections. There's 3 future climate scenarios that are explored in this report, and those are the ones that are hosted on climatedata.ca. So SSP 5, 8.5, which is a high emission scenario, SSP 2, 4.5, a medium emission scenario, and SSP 1, 2.6, a low emission scenario. These scenarios are chosen by climatedata.ca because they span a wide range of possible future climates. Unless otherwise stated in the report, the default pathway is a high emission scenario. On the graph on your screen, you can see 3 modeled periods as well as the modeled historical period, which is the part in green at the beginning. The future periods are in blue. The modeled historical period shows that there are about 7 days per year where temperatures are above 32 degrees Celsius in Halton. By the 2080s, under a high emission scenario, it's projected that there will be an average of 58 days per year above 32 degrees Celsius. According to modeling, the historical hottest day temperature has been approximately 35 degrees Celsius. By the 2080s, it's projected that Halton will have a hottest day temperature of approximately 40 degrees Celsius. In regards to hot overnight temperatures, historically there have been approximately 6 days per year where the nighttime temperatures did not drop below 20 degrees, also called tropical nights. By the 2080s, it's projected that there will be approximately 54 tropical nights in Halton. Hot summer days and heat waves become particularly stressful if overnight temperatures do not provide cooling relief. Tropical nights make it more difficult for the body to cool down and recover from hot days. Older adults, the homeless, and those who live in houses or apartments without air conditioning are especially susceptible during these heat events, particularly if they last for more than a few days. Physical impacts of heat can be both direct and indirect. Direct impacts include heat-related illness, which develop when extreme heat stress is the thermoregulatory capacity of the body, leading to illnesses including dehydration, heat exhaustion, heat rash, heat cramps, heat fainting, and heat stroke. Indirect impacts of exposure to extreme temperature, extreme heat include the exacerbation of pre-existing health conditions affecting the circulatory, respiratory, and cerebrovascular systems, resulting in increased emergency room visits and hospital admittance. It is also known to increase the likelihood of adverse pregnancy outcomes. The graph you see is the crude rate per 100,000 people for emergency department visits and hospitalizations for heat-related illness and extreme heat occurrences in Halton. Health data comes from the National Ambulatory Care Reporting System and the Emergency Department Visits Discharge Abstract database. While there were no notable association between the years with the hottest days and the rate of heat related to emergency department visits and hospitalizations, a trend may become clear as temperatures increase over time. Generally, mortality related to extreme heat increases with the intensity and duration of the heat event, with the intensity of the event having a greater impact than the duration. As temperatures increase, emergency department visits may increase due to heat-related illnesses, potentially exacerbating pre-existing health conditions. It's important to note that there are no specific diagnosis codes for heat-related illnesses. Other limitations include confounding factors, so people visiting the emergency department for respiratory season. In addition to physical impacts, heat can negatively impact mental health and well-being. Chronic heat stress can lead to increased levels of anxiety and stress, causing new mental illnesses and exacerbating pre-existing ones. Hospital admission for mood disorders, anxiety disorders, dementia, and psychological distress have all been shown to increase with heat. Warming temperatures have also been associated with increased violence. Studies have shown that exposing people to high, uncomfortable temperatures increases aggressive thinking, perceived aggression in others, hostile feelings, and violent behaviors. Extreme temperatures can also lead to a decrease in outdoor physical activity, which has numerous physiological and psychological benefits. While everyone can be impacted by extreme temperatures, some populations are more susceptible than others. Risks are modified based on an individual's exposure, psychological sensitivity, and ability to adapt to changing environmental conditions. In regards to exposure, outdoor workers, outdoor event goers, and people who are physically active outdoors are at a greater risk of heat-related illness because of their exposure to the hazard. Individuals who work outdoors and individuals working in high heat indoor environments and individuals working in high heat indoor environments, example, factories, kitchens, laundries, or boiler rooms, without adequate climate control, may be more susceptible to extreme temperatures due to their exposure. Extreme heat can lead to heat-related illnesses, increasing the risk of work-related injury and making productivity increasingly more difficult. Compounding this exposure is the fact that this work often includes increased physical strain and protective clothing. This past summer, the Toronto Star actually put out an article related to heat and workplaces. I can share that with my presentation when I send it to Trisha. People who are physically active outdoors also have a greater environmental exposure to extreme heat. They may temporarily experience increases in body temperature, and when coupled with exposure to extreme heat, have an elevated risk of dehydration and heat stress on the body. They may also have a reduced perception of risk and heat vulnerabilities and may expect their usual level of performance. In the United States, heat illness is the leading cause of death and disability among high school athletes. In regards to sensitivity, in pregnant people, exposure to extreme heat can lead to dehydration and acute kidney injury. Dehydration is also one of the causes of Braxton Hicks or practice contractions. It can also increase the incidence of dizzy spells and fainting. Children, particularly those under the age of 1, are at an increased risk of heat-related illness due to their limited ability to acclimatize physically and to respond appropriately to stress. Their physiological systems are not fully developed. They create more body heat per body mass than adults. They also experience faster heat gain from their environments and have reduced sweating and an inability to increase cardiac output, making them particularly sensitive to heat. Children also rely on adults and caregivers to prepare and protect them from these weather conditions. Halton Region is projected to record a growth of over 60% in the number of children aged 0 to 14 over the 2021 to 2046 period. Adults over the age of 65 are at a greater risk of developing heat-related illness compared to younger adults for a variety of reasons, including being less able to regulate body temperature through sweating, and they also may have reduced thirst sensation. Certain medications, including beta blockers, diuretics, antidepressants, and antihistamines, also make them more sensitive to heat by limiting the ability to sweat or by reducing blood flow to their skin. Visual, cognitive, or hearing impairment may also inhibit their ability to mobilize during periods of crisis or emergency or to seek out cooler environments during periods of extreme heat. Heat stroke and heat exhaustion may also be more difficult to detect in people living with dementia. Compounding risk is the fact that pre-existing chronic conditions such as cardiovascular disease, high blood pressure, and diabetes are more prevalent in older adults and are also risk factors in and of themselves for heat-related illness. Low income individuals, low income and social isolation can further increase the health impacts of exposure to extreme heat. Older adults who identify as part of a sexually or sexual or gender diverse communities, including two-spirit, lesbian, gay, bisexual, transgender, queer, are more likely to be socially isolated than other older adults, increasing the risk of illness or death in an emergency. In regard to adaptive capacity, which is the ability to adjust to climate change, including climate variability and extremes, to moderate potential damage. Sorry, in regard to adaptive capacity, which is the ability to adjust to climate change, to moderate or potential damage, to take advantage of opportunities, or to cope with consequences. Individuals may be unable to cope with health impacts of extreme temperatures due to either physical or social isolation. Isolation makes it more difficult for individuals to seek refuge during temperature extremes, as well as it impacts their ability to access appropriate services or supports. Social connectedness mitigates social isolation and may strengthen resilience and adaptive capacity by creating access to health promoting resources and social supports. Social connectedness and inclusion are an important protective factor for positive mental health. Individuals experience housing insecurity or insufficiency are particularly susceptible to extreme events due to inherent exposure, stigmatization, pre-existing illnesses, poverty, a lack of structural safety, and an associated lack of access to essential services. A large portion of individuals who are experiencing homelessness are also experiencing mental health and substance abuse issues. In addition, this group also has a higher prevalence of chronic diseases. At the end of each chapter, there's a summary table outlining vulnerability categories, and they're grouped by exposure, sensitivity, and adaptive capacity, and the population characteristics and percentage for Halton regions compared against Ontario is reported in each category. So you can see it on the screen right now. We look at employment, age, a rough estimate of number of pregnant people, and how that's determined. There's a note at the bottom the screen. We're also looking at housing unsuitability, individuals who live in apartments that are more than 5 stories. That's also covered, apartment buildings are also covered in the larger report. Now, I just wanted to draw attention to this. Researchers looked at excess deaths during 6 Canadian extreme heat events between 1936 and 2021. They noted that there were inconsistencies in mortality data, discrepancies between priority population identified, difficulties in determining the cause of death, and inconsistent reporting on social vulnerability indicators. But despite all of this, several common demographic and vulnerability factors emerged across 2 or more of the 6 events studied, including living with mental illness, in particular substance abuse disorder, anxiety and mood disorders, being over 65 years of age, living alone, being on low income, living in an urban heat island with little or no surrounding green space, and having pre-existing chronic health conditions. While I don't get into urban heat islands in this presentation today due to time, it is covered in the larger report, which as mentioned is available upon request. Data from the 2021 British Columbia heat dome found that overall, individuals with mental health conditions seem to have an elevated risk of heat-related death. This was most pronounced for people with schizophrenia, where the risk of death during this event was tripled. There are many reasons cited for this elevated risk. Schizophrenia can affect the brain's hypothalamus, which regulates temperature through sweating and shivering. It can affect an individual's ability to make reasoned decisions or sense of when they are ill. Some antipsychotic medications used to treat schizophrenia can raise an individual's body temperature, which can be compounded by extreme heat conditions. Individuals with schizophrenia tend to have other conditions that make them more susceptible to heat-related illness, such as diabetes. Individuals with schizophrenia have a 2 to 5 times higher risk of type 2 diabetes than the general population, both due to their disease as well as medications for its treatment. Schizophrenia is also associated with substance use disorder, isolation, and homelessness, other factors that make individuals more susceptible to extreme
So
heat.
what is happening right now? Is there, is the, a presentation?
Yeah. Can someone mute themselves?
Sorry.
Uh, just like vector-borne diseases, just like the vector-borne diseases chapter, individual actions are identified along with those of public health and other agencies, including municipalities. Halton.ca is preparing for heat events webpage, outlines ways that individuals can prepare their spaces for hot weather, including links to the Ontario Energy Board supports for electricity bills for low-income households, encouraging residents to have a digital room thermometer to know when their home is getting too hot, to speak with their doctor or pharmacist if they take regular medications to see if it increases their in risk in heat, developing a buddy system with people who may be more susceptible to heat. This page also outlines what to do during a heat event, keeping the home cooler without AC, finding cooler spaces in the community, watching for signs and symptoms of heat-related illness. Links are also provided to each municipality's website, and site visitors are encouraged to find out the hours and locations of cooling centers, pools, and splash pads in their areas. Public health actions include monitoring Environment Canada and climate change forecasts for heat events, issuing extended heat warnings, identifying priority populations. Public health shares targeted messaging via e-fax mail to facilities that provide care to priority populations, including long-term care homes, retirement homes, childcare centers, schools, congregate living facilities, shelters, and group homes. Public health also monitors hospitalization and emergency department visits upon request for heat-related illness and key heat-related health outcomes, including asthma, dehydration, and cardiovascular conditions. Public health also provides public education via website, social media, and media interviews. Public health has animated videos on preventing heat-related illness that are available on YouTube. There's also videos available for the Air Quality Health Index and also preventing cold-related injuries. Public health also provides input in emergency response planning, and we're currently updating the extreme temperature response plan to focus on heat as well as poor air quality as a result of wildfire smoke. It was going to play the video, but I'm just skip over that just in the interest of time. I provided a list of resources related to heat events. There's also one resource that I wanted to draw your attention to, and it's the Healthy Plan City. Healthy Plan City highlights priorities for improving equity, health, and well-being for all by showing where vulnerable populations experience lower than average levels of beneficial environmental conditions. You can explore different built environment features, including average summer temperature, air pollution, flood susceptibility, healthy food outlets, large natural spaces, noise, parks, recreation and sports facilities, retail and services, transit stops, and tree canopy coverage, as well as different vulnerable populations, including older adults, children, first generation immigrants, individuals living alone, visible minorities, low income individuals, and low income individuals within these groups. On your screen is low-income individuals living alone, where additional resources targeting average summer temperatures and can improve equity in Oakville. Oakville is compared against other similar sized cities. In this instance, Oakville ranks number 1 for equitable distribution. Um, it's 11:30 right now, and I know I have probably about 10 more minutes. Should I continue, Trish, or do you have Trisha?
I do believe there's one question. There is one hand up, so maybe we can pause for the one question and then, yeah, if you don't mind continuing on. John, I believe it was you.
Yes, thank you for that. My question is in terms of the Halton Region's heat warning and their definition because there's multi-day heat warning. And I've been talking to some of my colleagues and as well as staff member. We at the rec centers we use Environment Canada heat, which is day by day, to open up their relief centers and so forth for the public. They don't use the heat warning because it needs to wait for multiple consecutive days. I guess one the question I'm asking uh, is there a rationale or reason for the definition for the multi days?
Yes.
Because from a worker standpoint, from health and safety, Uh, day one can be hot, day two can be hot. We have to wait until a third day before, uh, if I use the Halton heat warning as a index, uh, they're exposed to 2 days of relatively hotter than normal days already. Is there plans
I can
for
actually
Halton
answer this
Region
one.
to
Yeah.
possibly reduce the duration of the heat warning from three
This is
days
intentional.
to
John?
two, or maybe
Yeah.
even mimic Environment Canada's reporting mechanism?
John, this is actually intentional.
Long
So this
question
is
there.
you're doing actually exactly what you're supposed to be doing. So Halton Region was the one that's responsible for making that change. We wanted you to use Environment Canada. There was a whole rationale that was included probably 2 years ago, directing municipalities and agencies to use Environment Canada. It's a capacity issue, and it has to do with redundancy. So Environment Canada, we get use the same criteria as Environment Canada. The extended heat warning is a category that Ministry of Health encourages health departments to use. So when an event is a little bit longer, they say that on the second day of a 3 day or more event to put out additional messaging. And so we are consistent with that. But for programming purposes and alerting purposes, we encourage and we've sent messaging to all our municipal partners telling them use Environment Canada because Environment Canada has forecasts 3 times a day. They have things are automated. There's more staffing, so you can get alerts much sooner, and you can be much it can be it's much faster to do by doing it through Environment Canada. So that's great. They're using Environment Canada. Unfortunately, we're not going to be changing back to that, and it's again it's a capacity issue. There's really only the one staff member that it's myself that does the heat warnings. So it wasn't as practical for us to do that. So we just focused on longer events to push out additional messaging for that. But that's great that you're using Environment Canada. And again, we sent out messaging to the municipalities to do that.
That's
Thank you
great.
for that.
Yeah, thank you.
Okay.
Yeah, I know we're getting near the end, but if you don't mind giving us a little piece of the extreme weather, and then if
Yes,
anyone else has any questions, you can raise your hand and we will try to address them at the end. Thank you.
no problem. Okay, so the next section is just a snapshot of the extreme weather from the highlight report. So the main report does get into flooding, as well as drought, winter storms, flash freezes, freezing rain events, and wildfire and wind events as well. There have been several notable extreme weather events in Halton Region, including the 2013 ice storm, where over 31,000 residents were without power for 2 or more days, and some residents were out power for 8 days. There was also the 2014 flooding in Burlington, the 2022 derecho. Unlike a hurricane, a derecho goes in a straight line. That event had actually resulted in over 1 million people without power, so widespread power outages as well as significant property damage. And there was actually 12 deaths reported across Ontario, Quebec as a result of that event. And the last big one was last July's flooding, where Halton received reports of over 1,800 basement floods across the region. Projections show that by the 2080s, Halton Region can expect an average increase in total precipitation of 62 millimeters in a lower end, in a best case scenario, and up to 145 in the worst case scenario compared to baseline years. So it's variable. Precipitation events overall are projected to increase in intensity by 6% to 7% for each degree Celsius increase in temperature. Climate change is also expected to increase the likelihood of consecutive extreme weather events. Extreme weather can impact health directly and indirectly. Injuries, illness, and death can be a direct result of extreme weather. Indirectly, treatment of chronic illnesses can be impacted because of displacement, power outages, overcrowding of medical facilities, and increased demand for medical supplies. Indirect impacts can come about because disruptions to critical infrastructure, including electricity, sanitation, water treatment, food refrigeration, communication system, and transportation. Disruptions in transportation can prevent access to jobs, education, and essential services. Of note, carbon monoxide poisoning is associated with ice storms and other extreme weather events, including snowstorms, hurricanes, and floods. This is a result of using alternative fuel or electricity sources for heating and cooking during power outages that can result in buildup of carbon monoxide in homes and garages. CO exposure can cause health problems because it reduces the body's ability to carry oxygen in the blood. During the 2013 ice storm, 98 cases of carbon monoxide poisoning were diagnosed in Toronto emergency departments, compared to 2 to 7 cases over the preceding 5 years. As well, the City of Toronto Fire Services also saw 5 times the volume of carbon monoxide related calls. While everyone can be impacted by extreme weather, some populations are more susceptible than others. Risks are modified based on individuals' exposure, physiological sensitivities, and ability to adapt to changing conditions. In regards to exposure, it, their key population groups that are affected include commuters who have a greater exposure to extreme weather events, particularly when commuting on highways at high speeds or rural roads, or risk of getting stranded or risk of crash or collisions due to poor road conditions may be higher. People living within the boundaries of floodplain can be differentially exposed to risks associated with extreme rainfall events, where flood risks are higher. Low-income households living in areas prone to flooding may not have the ability to relocate, which increases their risk of exposure to flood hazards. These include accidental morbidity and mortality from counting floodwaters, or the risk of waterborne contamination if floodwaters contaminate drinking water sources. Utility workers, emergency workers, and first responders, including healthcare and public safety workers, are at an increased risk for injury during and after extreme weather, as they often need to be outside during severe weather events, which also increases the risk for death or injury from lightning strikes, flooding, high winds, or other weather conditions. In regards to sensitivity, older adults may be more psychologically sensitive to extreme weather, and physiologically sensitive. According to the Canadian Institute for Health Information, almost 8,800 annual fall-related hospitalizations in Canada occur from people slipping on ice. Approximately 5% of all hospitalizations related to falls, Canada per year. Falls are the most common cause of injury and leading cause of hospitalization among older Canadians, and it estimated that 20 to 30% of older adults experience one or more falls each year. Further, a recent literature review identified that older adults account for high levels of morbidity and mortality from extreme weather related to climate change. Children and young people can be impacted by post-traumatic stress disorder because of storm events, especially children who have experienced anxiety or depression symptoms. However, individuals do not need to have been directly experienced a climate change impact to suffer mental health impacts. Climate anxiety and eco-anxiety, which refer to distress relating to climate change and ecological crisis, have been gaining worldwide attention. Children and young people have been identified as priority populations. In 2023, Sheridan College was invited by the Oakville Community Foundation to conduct a survey of local youth to learn about youth perspectives on climate change and climate anxiety. And findings are actually shared in their report as well as in our climate change and health report. In regards to adaptive capacity, people dependent on caregivers and those who are socially isolated have a great reliance on others during emergency events. And without enough preparation, individuals with disabilities may not be able to safely evacuate. As well, power outages can affect elevators, which can make it difficult for people to evacuate. Individuals who are underhoused or facing housing insecurity may also be more impacted by virtue of not having safe housing conditions during emergencies. Individuals living in substandard housing may be at higher risk for injuries due to falling debris or from flooding. As well, individuals with low income may lack the insurance support to cover costs associated from damages. People with drinking, substance abuse issues, or on medications that affect their cognitive capacity may be at risk as well, preventing their ability to make decisions and understand risk communication messaging and actually remove themselves from an affected area during an emergency. So I'm not going to get into too much about the adaptive actions, but they are on here. Individual actions are noted, as well as public health actions are also identified, including putting out messaging and alerts, especially on checking on neighbors and ensuring you have adequate emergency supplies. I've also included some resources for extreme weather, including those from Halton Region and the Intact Center on Climate Adaptation, as well as those from Conservation Halton. And that concludes my presentation. Apologies for running over. And if time allows, I'm not sure if it does, I can answer any questions. If it doesn't, feel free to email Trisha any questions you might have, or you can email myself. I'll provide my email address, and I can answer any of those if we don't have time today.
Great. Thank you very much, Nadia. That was a lot of great information. And I know it only touches the surface of your actual climate change report. It just
Yeah.
is, yeah, just a couple of the impacts that Halton Region is expected or is already experiencing. So thank you very much for that. It was very relevant to this audience. I mean, the main purpose of the Oakville Ready program is to build that adaptive capacity kind of at the community level and that climate resilience. So a lot of great information. I got a lot of great thoughts. I've had the pleasure of hearing her presentation before, so I'm going to open it up to other questions. If there are any, just raise your hand and unmute yourself. I think I can see everyone here. I think you did mention in your presentation, but I did just want to, on the point of ticks, there is
Yes.
a great website that the region alerted me of, tick.ca. So if you
Yeah.
do find a tick on yourself, I believe, right, Nadia, you can take a picture of it with the app and it
Mhm.
will identify whether it's a black-legged tick or one of the ticks that you might, want to take some extra precaution around. So that's a great resource. And also like the tick ID card and those intact flooding materials. I have all of those materials as well. We use them for our outreach. So if anybody does want any of those, please just let me know. And we see Halton has their hand up there. Go ahead.
Hi, Nadia. It's Cindy Toth
Hi.
with Halton Environmental Network. And sorry, my video is off because my signal's unstable.
Okay.
Just two points. One is offering observation on the prevalence of ticks and the vector-borne disease uh, uh, issues. It's
Mhm.
really important for us to understand that these vectors are here.
Mhm.
We really made efforts this year to educate our staff and our volunteers when we are working in places like the Oakville Food Forest over at Kingsford Gardens because they were there. I had 4 on me one day, and I'm thinking, yeah, not a happy me. But we started to offer to our volunteers and staff the appropriate insect repellent, both DEET and a natural offering, so that it was immediately available. And in our prep talk for volunteers and staff, we emphasized the instance of ticks being present. And I think we all have to understand that they are not necessarily in all of the places, the forests, the grasslands. They can very easily be in our long grass, weeds around our properties. They can be in our gardens. So it's
Mhm.
just to be really aware of all the great tick sense information out there so that we can, one, be aware ourselves, and two, to advise our networks, families, communities, etc. Because with proper preparedness, it is avoidable. The second is that I really am appreciating the strong connection to mental health and well-being related related to climate impacts, because it's often unappreciated how much the depth and the breadth of climate impacts. And one thing stood out is that we all understand being outside brings a feeling of mental well-being, and that can be severely compromised. We saw it this summer, and this is
Mhm.
one of the hottest summers that I
Yeah.
noticed. 2020 was also a very hot summer, as well as I think 2005, which is surprising. They seem to be popping up, but the impact on outside activities was really
Mhm.
severe this year. And for people holding outside events, I think it's something that we also have to understand, whether it's a fair or just classroom activities, is having appropriate hydration, preparing for this, because this is going to be our new normal. So thanks for that. It was a great report. Great to hear your presentation.
Thanks so much, Cindy. I wanted to just add to that. There in the presentation on the resource slide, there's a really, really great one from the National Collaborating Center. I didn't get to show the visual of it, but it actually shows things you can do around your home to prevent ticks coming by. Like one of the things is like wood chips. I don't really like going from tall grass to wood chips. So having like a border as well too. So there's a whole bunch of really great tips on kind of like tick proofing your home. Yeah, they are here. And we get, I think, the most significant thing I think from the report was the vector-borne diseases section. And just generally, lots and lots and lots of people want, every time you go to talk about Lyme disease, people want to talk about ticks with you. We bring little ticks with us for people to see. People are so surprised at how small they are. And it doesn't really surprise me that so few people that of the cases we looked at, so few of them actually saw the tick on them. It's deliberate in the tick's biology. They don't want you to see it because they need to be attached for a certain amount of time to actually pass on Lyme. So that's a really good point that you bring up there, and that's really great that you're providing the education to your volunteers and staff, as well as also providing them with insect repellents and whatnot. And in regards to the mental health aspects, there's tons more of it even in the report. I could probably do an entire thing on just the mental health findings related to all of these. Like all of them have mental health impacts. We even it's an older report now, but after the Burlington floods, the Water Intact Center for Climate Change did a report on the residents after the Burlington flood, and like the significant numbers still every time it rains, they have like post-traumatic stress after the rain. Like they hear it and it's terrifying. And I can't imagine like having been in that, if you were in that in 2014 and then having that again happen last year in 2024, and it could be a lot of the same individuals in the same places, right? So it's really scary. And thank you so much for bringing that up as well. Yeah, anything we can do, the public health can do to provide additional resources, just reach out. We have tons available that we can share.
I think that's great, that what to do around your property would be really good. As I mentioned, I was at the fall fair this weekend, and I had a lot of just property gardeners just saying, I was out in my backyard maintaining my garden and I found ticks, right? So you don't have to be going for a hike or anything like that, just working around your yard. And also, thank you for the reminder of My Healthy City, that website. That is we have used it in the past and through the Community Foundation's report and work. And that is a really good website. And I will pass that link along in our debrief email, because you can put in your postal code and really see what are the vulnerabilities in your neighborhood in regards to shade cover, urban heat island, social services. It really goes over a wide range of impacts. So that's great. Thank you. And yeah, you kind of tempted me, Nadia. Maybe we'll give you, 6 months off or something, but maybe next year it would be great to have you come in and kind of talk about the mental health and wellness aspects or impacts resulting from climate change. But we'll give you some time. Thank you very much. Thank you
Thank you
so
so
much
much.
for the presentation. Like I said, everyone did get the executive summary. If you do want the full report, just let me know and Nadia can send it along and we will pass along this presentation. So thank you so
I'll
much for
actually,
joining us.
with the presentation, I'll just throw in the full report. It's not a huge file. I'll put it in with what I send you, and anyone who wants it can have it.
Amazing.
Perfect.
Thank you so
Thanks so
much.
much. Have a great day, everyone.
You
Thanks.
too.
Bye.
Bye.